KSJE is supported by San Juan Regional Medical Center, a community-owned and operated hospital. Here for you when you need us. From emergency care to routine checkups and screenings, caregivers are here and ready to provide the safe, high-quality care you need close to home. Online at sanjuanregional.com with the latest health information and resources to help you live life better here. KSJE is supported by the University of Denver Graduate School of Social Work Four Corners program. Proud to offer a Master's of Social Work degree in the Four Corners community. Application for the 2022-2024 cohort is open. Classes are taught Fridays and Saturdays in Durango. Find out more by emailing janelle.doughty, D-O-U-G-H-T-Y, at du.edu or at du.edu/socialwork/Four Corners. 11 minutes past 8 o'clock. It is Wednesday morning, the 9th day of March, 2022. Good morning, everyone. I'm Scott Michlin, and thank you for tuning in to KSJE 90.9 FM, of course, over the air here in San Juan County. Everywhere else on the planet, you can tune in at KSJE.com. And we also welcome our viewers who are watching this community-supported visual radio station. The video is streaming live this morning out to the KSJE Facebook page, our YouTube channel, and our Twitter account. So we're glad that you were with us this morning, everybody, because coming up, I'm going to be talking to a local surgeon. Dr. James Boyd is here. He is with San Juan Health Partners General Surgery at San Juan Regional Medical Center. We'll be talking about the work that he has done coming up in the next few moments right here on KSJE. Then later on this hour at 8:50 a.m., Ron Price is going to be here with another lesson for us about life in the sandbox. This week, Ron is talking about good-hearted living. You'll hear more about that today at 8:50 on KSJE. And then next hour, Mick Hess is going to take us roving with the arts. Today, Mick has a 90-minute version of the program. He is featuring music from Shostakovich. That's coming up today, 9:06 on KSJE, which will take us to 10:30 and our local and regional author program right on Four Corners. Tracy Helsvass is speaking with author Lynn Blackwood about his book, See If You Agree. You'll hear more about that today at 10:30 on Right on Four Corners, KSJE. Don't forget, you can also connect with us on our Instagram page in addition to Facebook and YouTube and Twitter. And if you're a podcast person, you can subscribe for free and listen to KSJE podcasts wherever you listen to podcasts, like all these places on the screen right there. iHeart, Spotify, iTunes, and Pandora. Check it out and take us with you on your travels this spring. Weather forecast, it's 28 degrees outside our studios this morning with a mostly cloudy Wednesday underway. We're expecting an increase in clouds today with a chance of some rain showers later on this afternoon. The high today, 48 in Farmington. Maybe some rain and snow showers overnight tonight with a low of 32. More snow showers on Thursday with a high near 40 tomorrow. Overnight chance of snow showers, 18 for a low Thursday night before things clear out on Friday with a mostly sunny day. The high 42 degrees, 18 overnight, and maybe near 50 for Saturday, mid-50s by Sunday, and back up to near 60 with sunshine on Monday. Well, let me introduce my guest who is back with me this morning after he's been gone for a long time, but it wasn't anything I said. He told me that. James Boyd is here. Dr. Boyd is here from San Juan Health Partners General Surgery. Dr. Boyd, welcome back to KSJE.
Hey, good morning. Thanks for having me.
You bet. Good to have you back. I know it's not me that kept you away. You've just been very busy.
No, it wasn't you.
Okay. All right.
We've been a little busy.
A little busy for the past 2 years for sure.
Yes.
And it impacted you as well, right? You were dealing with COVID stuff like everybody else at the hospital, correct?
Yeah, I mean, any healthcare provider it affected. As a general surgeon, I take care of inpatients as well. So often consulted to help the medicine team manage some of our COVID patients and some of the complications associated with advanced COVID pneumonia. And then it certainly affected our just regular surgical practice. At certain points we completely shut down elective surgeries when we were either anticipating or directly dealing with, surges and patients.
Right. And in your career, have you ever seen levels of patients that high in any facility you've worked at that you saw in the past 2 years?
I've never imagined that we would be way over our, stated normal capacity. Never imagined that.
And that happened in a few of the waves, right? I mean, It wasn't a constant, but for a few weeks it was a constant for sure, correct? During some of the peak times of COVID infections.
Yeah, correct. Early on in the first wave, the issue was more learning about COVID and PPE supplies. We just weren't prepared for that level of needing that level of PPE.
Right. Well, there were shortages. You couldn't get it. You couldn't find it.
Absolutely.
Yeah.
A lot of creative solutions. A lot of people in the community stepped up to help with that, so that was great. The most recent wave, it was not an issue of PPE. We had stocked up on that. It was just the Delta was so infectious, and just the volume of patients, combined with, we have the same staffing shortages that pretty much every hospital in the country has right now. So.
Right. And so, and the folks that were coming to the hospital to be admitted to the hospital were the sickest of the sick. I mean, a lot of folks certainly that had COVID were being treated maybe with the COVID at home program and other things like that, but it was the folks that were really suffering, really, really ill, and maybe had underlying conditions and other things that just had them, they needed to be hospitalized.
Sure. Yeah.
And so you got the worst of the worst patients.
Yeah, there's all levels, and certainly a lot of people got it, stayed home, or maybe didn't have symptoms, but many needed to be hospitalized, and as a regional hospital, we take pretty much everybody up to the very sickest. So.
Right. And we've heard, of course, of the other folks that were coming in to help, some of the military, I think it was military folks that were coming in to help with staffing at the hospital as well during some of those peak times, and so again, working with other folks and training other folks, that was probably new for you as well, and to be around that type of thing.
Oh, yeah. This was all completely novel to anything I've ever experienced, but we're super grateful. I mean, they certainly helped us get through a real tough time.
Right.
Especially some of the Navy staff that stayed the longest.
Right.
It really helped in the ICU and in the ER.
Sure. And for some folks watching us and listening to us this morning, they may think, well, what did a surgeon do during COVID? Because there wasn't a lot of surgery when it came to COVID patients. But as you were telling me before we came on the air this morning, you were called in to help out from time to time doing some of these tracheotomies or things along that line, right, for some of these really sick folks.
Yeah, so the people with the most advanced lung disease where significant damage to the lungs led to either needing like a chest tube placed in the chest to drain air out of the chest, or oftentimes putting breathing tubes into the neck. That's called a tracheostomy. Those were for people that were just struggling to get off the ventilator.
Yeah, okay.
Couldn't get off the ventilator, so that they could. Well, there's a number of advantages to doing it. One is to actually help them get off the ventilator. It's easy. It's more comfortable to have a tracheostomy. I could go into the technical details if you're interested, but it's more comfortable, and then you can also go to like long-term care facilities and stuff if you have a tracheostomy, whereas if you have a normal breathing tube, you can't. So I did more tracheostomies in the last 2 years than I did in the first 9 years that I was here.
Wow. Just because of COVID, basically, right?
Yeah.
Those were pretty much while you were doing that.
Oh, yeah.
So, but now it's a different story these days, thankfully.
Yes.
And we're all thankful for that. The crisis standards of care have been rescinded at the local hospital, and so things are kind of getting back to normal. But as you were telling me again before we came on the air, all the folks maybe that couldn't do elective surgeries during some of the COVID times when things were so very, very busy at the hospital, now they're calling to say, hey, can I get that new knee or that new hip or that new whatever, right? And so surgeries are picking back up.
They're picking back up as much as we can with staffing. The main COVID wave is mostly over. We still have COVID patients in the hospital, but we're at reasonable levels now, and now we're dealing with this unique situation of this once in a century pandemic that has pushed back normal medicine. Times when I had to close my regular clinic, cancel regular surgeries. There's already data coming out nationally about how far behind we are as a country on screening colonoscopies, on screening mammograms, and just general preventative health care across the board. Like you said, someone's with a knee or something, maybe someone's had a bad knee that they've been, I need to get in there and get seen, but if you also are older and have a bad knee and don't want to be exposed to COVID, maybe you put that off. So we're getting to the point that everyone I'd encourage everybody to really look at your general health, and if there are preventative health things that you've been putting off, it's time to start thinking about that again, and we will do our best to help accommodate. We are generally backlogged in a number of things, but certainly, if you need to get your cholesterol rechecked or check your A1C for diabetes, do all that stuff, because we're going to see the secondary effects of this pandemic for years, and we'd love to mitigate that as much as possible.
Right, and that's a big concern among you and your peers, right? That a lot of these folks that have put off some of these just routine things are now going to go back in and get them checked, and they're going to find out, hopefully not, but they might find out, oh, this is pretty bad, and we probably need to, do something quicker, sooner than later, because of the delay in just finding out how advanced whatever we're talking about is. And God forbid it's cancer or diabetes or what have you. Is that what we're saying?
Yeah, and I've already seen it. I've seen cancers that we had to cancel the screening stuff back during the early pandemic, and by the time they came in, it was more advanced. So, and it's going to keep going. That's going to be an effect that lasts for years.
Right. And not that it's not treatable, but it's just maybe more of an issue, I guess, right? When you do finally come in for treatment, it may be harder to treat or longer to treat than it would have been if caught early. We hear that about everything, whether it's heart disease or cancer or what have you, right?
That's true, yeah, absolutely. It's true with pretty much any disease, especially cancer.
Yeah.
The earlier the stage you catch it, the more treatment options there are.
Got it. Very good. And so you were telling me, too, though, that you do have a plan to help with some of the load of patients that are coming in. You've got a new partner maybe that's coming on board in a few months, right?
We did. We have a new partner that just signed a contract. She's coming from Nebraska, I think. But hopefully starting this summer, this fall, yeah, we're trying to help anticipate the community needs and grow with the community. And
very good. Well, that's good, I think, maybe to help, again, as you mentioned, if you've got this big rush of people coming in that need surgeries, right? This will help to deal with some of that stuff.
It will help, yes.
And so in your practice, what do you deal with mostly? Is there any typical type of patient or surgery that you do in normal times? I have to put an asterisk by all these questions, because pre-COVID, what was a typical type of thing that you would do?
Well, I'm a general surgeon, so that's a lot of things like hernias, gallbladders. We operate on the colon, the intestines in general. And then as a group, we cover all the emergency surgery, so we're involved in traumas, and anything that would land you in the ER for a surgical emergency that doesn't involve the brain or the bones.
Right. That's you.
We get involved in a lot of the other stuff, yeah.
Right. Well, that's a lot of stuff. And so we were talking, too, as folks start getting out and about, we're going to probably see more car accidents and trauma from those and things along that line. We have the typical unfortunate violent crimes that people end up in the emergency department, stabbings and gunshots and things along that line. That's stuff that you have to deal with, right? You're in that emergency department fairly regularly, I'm afraid, huh?
Fairly regularly, yeah.
Dealing with whatever walks in the door or gets pushed through the door.
Don't often go a call shift without seeing at least one trauma. So trauma is something that tends to spike in the summertime anyways. People get out, out and about, driving more, getting together more, drinking more. And with this, with the excitement of kind of the pandemic coming to an end, I think a lot of people got a lot of pent-up energy. I mean, I certainly do.
Right.
And everyone wants to get out, so just want to encourage everyone to do it safely.
Right.
If you're going to drive, do not drink. If you're going to use firearms, use them safely, and once again, do not drink.
Yes.
Pretty much it's amazing if you look at the trauma data, how many traumas are associated with alcohol, whether it be anything from off-road vehicles to regular street vehicles to knives or guns, often associated with alcohol. So just be smart, get out there and enjoy life. It's going to get warm here soon, and everyone's pent up, and
we're ready to go.
But
you're right about that. Do it smartly and safely. Very, very true. I know for you, when you get rid of some of your pent-up energy, you're on a closed track, usually.
When I drive cars?
Yes.
Yeah. Yes.
You choose that.
I only drive cars
to go
fast on a closed track.
Yes, sir. And that's
a lot of safety equipment and no alcohol.
That's true. Very good way to do that. But my guest this morning, Dr. James Boyd, is here. He is with San Juan Health Partners General Surgery. He's a general surgeon at San Juan Regional Medical Center, talking a bit about the work that he does at the hospital and the work that he has done during COVID. And now as we hopefully are coming out of COVID and things start getting back to normal, folks start planning some of their surgeries and other screenings and things along that line that maybe they hadn't been doing over the past 2 years. And again, I want to go back to that for a moment because it's just so important, I think, to talk to folks about, getting those regular checkups and, not fearing going to the doctor because, we've seen these precautions and I think everyone's been able to get the help that they need. They may have had to wait a little bit when things were really full, but medical care was still being doled out even when you were under crisis standards of care. No one was ever turned away from the hospital.
Oh, definitely not. And I'd like to, commend some of the hospital leaders, especially some of the physician leaders who manage the crisis standards of care. It was done well, and I think pretty much everybody got, the same care there. Our max best care that we could give. We worked really hard to ensure that.
Right.
It was just kind of an issue it was just a resource issue, we needed to set those crisis standards of care to say, like, we are doing the best we can with the resources we have.
Right.
But now we're past that, and we're officially off of it, and also I can just tell you practically, it feels, and I hate to use the word normal, that we've all cautiously used over the last, couple years, but it does feel, more normal, and we're trying to start to think about the future. We've got ideas and plans on how to continue to expand care in the community, and
that's exciting.
To improve the hospital,
Right. I imagine some of those plans were kind of put on hold during the last 2 years to just try to deal with what's happening right now rather than planning for 2 years, 5 years from now, whatever the case may be.
Yeah,
for a lot of folks.
We were in survival mode for a while. Yeah,
right.
Absolutely, like you said, same for a lot of folks.
Yeah.
Trying to come out of that and refocus and move on. The world's going to move on, and
sure. Well, and I think and not that I want to dwell on crisis standards of care, but I just wanted to make sure the audience understands that part of that was that it wasn't just San Juan Regional under crisis standards of care. It was every hospital in our state and in our region. And part of the issue, I think, was in normal times when a hospital gets overwhelmed, they can transfer patients out and get help and make room. But during some of the peak times of the pandemic, as we heard from Dr. Underwood and other folks at San Juan Regional Medical Center, they were calling hospitals in Oklahoma, in Arizona, and beyond to try to find a bed, and there was nothing available.
And those hospitals were calling us, too.
Yeah, right, because they were full.
Begging us, saying, you can take anybody. Yeah, so in the first wave, we had way back in March of 2020.
Yeah.
We had a decent-sized wave here in the Four Corners, but it was really localized. We were transferring patients to Albuquerque and to Phoenix every week, pretty much.
Sure.
So we were able to offload a lot of patients and keep functioning at a normal level. But during the fall, it just hit everywhere so hard, especially in the Southwest. Texas was getting crushed.
Right.
Arizona was absolutely crushed. Colorado and Utah at the same time. So hospitals all over the place were on crisis standards of care. And even if they weren't officially under that label, they were full.
Yeah.
They were trying to transfer to us. And there was absolutely nowhere to transfer patients for a time period. I will say UNM still stepped up, and some of our really complicated, complex trauma patients that had there's certain injuries that we absolutely cannot take care of. We don't have the subspecialists, and we could usually still get those patients transferred. So there was a lot of collegiality. It was just it was a matter of resources across the region.
Right. Well, and how it was described to me and to our audiences was that we're kind of all in this together, and there was really a lot of help, and it seemed too that at times when maybe our cases weren't as high as other places, you were able to accept patients from other hospitals to allow for them to transfer folks into Farmington so they could have room in their facilities for their locally high caseloads for whatever time period that was, too.
Yeah, we did. Our Delta wave was a little earlier than maybe some of the other areas, and so we were kind of coming down off of our wave and still had some of the Navy personnel, and so we were taking some people in.
Right. So it really, I think it just showed how cooperative everybody, all the medical community, seemed to be working together to just manage these just outrageous numbers of patients that we have not seen in a lifetime for a lot of folks.
Yeah, there was a lot of collegiality and problem solving. Like we said when we started talking about this subject, this is just an unprecedented era,
Right.
something I had never imagined. I read about the 1917 pandemic, but you don't really think you're going to live it. So it's been an interesting time.
Right. Well, and I imagine there's a lot of folks that are looking at, God forbid, the next one, but I think we've learned a lot during the last 2 years and probably learned how to manage this and maybe learn by doing.
We've learned a lot. Are we gonna apply it?
Well,
I hope.
Yeah, me too. I think we all do. But moving forward, as COVID maybe becomes more endemic than just a pandemic, and we manage it and learn to live with it and things along that line, I think that's kind of where we're headed today. Would you agree?
Yeah. It's going to be endemic for sure. This is a virus that is now in the human population and will be
Right.
pretty much forever.
But we have treatments, we have vaccines, we have a lot of knowledge about how to deal with this type of infection, virus.
Yes. Yes, that has come a long way.
Right.
And it's going to continue to move across the world. You have to remember, a lot of the world is not vaccinated, doesn't have access to vaccines yet. And but in the U.S., I do not think, personally, I'm not a virologist or an epidemiologist, but I don't think we're going to have another wave of the COVID-19 virus.
Right.
You have to remember, COVID is a coronavirus family. This is a broad family of viruses that
you've seen before.
Yep.
Right.
And there will be another version. I'm not saying that it's going to be another pandemic level.
Right.
We'll just have to see. The world is getting more crowded. There's a lot of people. Viruses move around and there's a lot of people. So I'm not saying that anything to specifically worry anybody. Like you said, we learned a lot of things. I think we're going to be fine certainly we're going to be fine with COVID-19 in America.
Right.
It'll be percolating probably for a few years, little pockets here or there, or we'll probably see patients here or there. But I'm not. Anybody who makes COVID predictions ends up looking like an idiot. But I will say, I think that mostly in the United States, anyways, we're done with the main problems.
Right. And I think anyone in public health has always known that there's the possibility of a pandemic type virus, right?
Yeah.
And they've been talking about that for decades, I think. We just didn't have one until 2 years ago, really.
I was a
microbiologist.
Excuse me. I was a microbiology major in college, and that was 16 years ago, 17 years ago. We haven't talked about it then in our virology class.
Right.
And like I said before, I just never imagined it could happen. But I knew that it could happen, but it's kind of like you don't walk around worrying about a meteor hitting or something.
Right. Very true. But you had a front row seat for this one, unfortunately. But that's all right. Let me go back to your job as a general surgeon and talk a bit about of course, the job that you do, and it seems like the trend to me has been, to get patients maybe out of the hospital to have their recovery maybe more at home than in the hospital. Is that still kind of part of what you try to do? And that seems to do better for the patient, doesn't it? If they can heal at home, if they're well enough?
Yes. A lot of research has been put in over the last couple decades, actually, about expediting and optimizing recovery for patients. There was a time before I started training when if you needed your gallbladder out, you came in the night before.
Right.
An intern or somebody saw you, probably checked you in, got you set up for surgery. You got a big incision. You were in the hospital for maybe 3 or 4 or 5 days. You might have had some drains coming out. They were slow to give you food. And then over the years, the research has shown that's just not necessary. And so now we try to optimize patients being able to be at home. The hospital's not a place you want to be unless you have to be. It's hard to sleep. It's uncomfortable beds. There's a lot of beeping. They wake you up for your vital signs. And even things like patients being able to sleep all night was something that maybe was not appreciated a couple decades ago. And then over the years, the research has shown it's like, no, if patients can sleep and
Right.
eat the food they like, they're going to eat better.
Sure.
And so in many different aspects, we've tried to optimize that. Colon surgery has been a huge one. It's changed even from when I started my training. And it's all very evidence-driven. Really good studies. Really started in Europe. They started looking at it, saying, hey, do we really need to keep everybody 2 or 3 or 4 days? Do you really need to wait for 3 days after colon surgery to give someone food? And the data just keeps coming back that that's not necessarily true. So we keep working on optimizing recovery pathways, and if it's safe to recover at home,
Right.
then we do that.
And I know each patient is different. You certainly
Absolutely.
can't make a general statement that everybody gets
Yeah.
discharged after 5 hours or whatever the case may be.
Absolutely. It's where the art of medicine comes in, and
Right.
The years of training and experience that I have tried to apply to patients. Don't send anybody home unsafely. But
Very true. And even some of the types of incisions are smaller now than they used to be, I would think, too, right? Don't you try to be as least invasive as you can be and still get the job done?
absolutely. Been a lot of progress in my specialty for minimally invasive or less invasive surgeries. The majority of hernia surgery I do now is laparoscopic or minimally invasive, whereas even 7 or 8 years ago, I still did the majority with the open kind of classic incision. So that's improved. Colon surgery has certainly improved. Gallbladder surgery was already completely laparoscopic when I started training. I know orthopedic surgeons continue to progress in that. Neurosurgeons and spine surgeons continue to progress in that. Can't speak for their specialties in as much detail, but it's a general goal. If it can be done safely, if you can develop a technique to do it through smaller incisions, usually involving a camera,
Right.
then we try to do that.
See? Everyone's getting cameras these days, even radio
Yeah.
stations. So there you go. Very good. Well, Dr. Boyd, we are out of time this morning, but it's been a great conversation with you. Thank you for coming in.
Thanks for having me.
You bet. Very good to see you again. Dr. James Boyd, my guest this morning from San Juan Health Partners General Surgery, with me this morning here on KSJE. KSJE and San Juan College present the Student Success Coaching Tip of the Week.
Hello, it's me, Emin Chi, from the Student Achievement Center. We're bringing you week 8 of Coaching Tips of the Week.